Namaskar, this is Dr. Munjal Thakar. I am a professor of Materia Medica and PhD guide at Parul University. And on this World Asthma Day, we all know that homeopathy has a very effective treatment for curing asthma. From childhood asthma to adults, for years together, patients have sought help from homeopaths to get rid of their asthma. And I take this opportunity to present one case of asthma that is I found very interesting, and it could be very interesting for all of you too. So this is a case of a 45-year-old woman who has allergies since 2015. She had consulted me in 2022 or 23. She gets dry cough and she will retch while she's coughing. She's better when she's walking, which is very interesting. Most asthma cases would be worse when they walk, but this woman is better when she is walking, and she's worse when she's in the middle of a stage, on the stage, or in the middle of number of people. This asthma, this cough is better lying on the abdomen, and worse lying down. She is unable to lie down because she gets breathless from that. It is worse from March to August. It is worse talking, worse perfumes or strong smells, and this has appeared after her COVID, this sensitivity to perfumes. She also cannot tolerate dust since COVID. And the cough causes pain in the chest. She's sleepy during the attack of her asthma, but she's unable to sleep because of the distress. In June 2022, she was unable to sleep. She had to get up with a sense of suffocation. She cannot tolerate closed spaces like aircrafts and theaters, and she cannot tolerate darkness. She must have light even during the asthma, or whenever she gets depressed, she says, I need this light. I cannot stay without light. She cannot sit in the theater and she has to get out of it, and also she cannot sit in an air-conditioned car or a plane, and MRI machine. All this contributing to her claustrophobia. She says, if I can't pass flatus or eructate, it causes chest pain and shoulder pain. I have constipation and hard stool. She has a strong family history of both the parents having diabetes and hypertension. Her grandfather died early out of myocardial infarction. Grandmother is healthy. Maternal grandfather died in an accidental death, and maternal grandmother died a natural death in 1986. Her brother has got gout. In the past history, she has uterine fibroid or a polyp which had relapsed, a fallopian tube with an infective focus in the past, and she had undergone hysterectomy. During the pregnancy, at 7 months, severe vomiting, she had become icteric, and LSCS, the child had died after 23 days. She had a twin pregnancy after a year due to the past history of early death of an infant. She was rested for 9 months. It was a pre-planned LSCS beginning at the beginning of 9 months. It was a twin pregnancy. In 2003, left shoulder tear. Maybe it is because of low calcium, is what she was told. She is extremely anxious about health. She will dig deep into her health problems. With flatulence, she fears she has a heart disease. She will keep getting investigations done, mammography, ECG, 2D echo, and everything. And once she learnt a friend having a breast cancer, then on she will routinely do a mammography. She's very anxious when she's alone. She's anxious when she was shifted to a new city, and she had a fear that something will happen to her and there would be no one to help her. She gets very anxious if she hears anything bad, and she's very anxious if her kids fight and do not bond. She seeks for family security. She's very timid and she would never take risks since childhood. She fears accidents, therefore she avoids road trips since she has seen accidents with family and friends. As a child, she was very obedient, very sincere, and very diligent. In fact, she was the example for the rest of her classes. She has studied fine arts for the past 5 years, and she did tuitions to pay her own fees during her own graduation. This is a kind of brief history that we get. And if we look at the totality as per the organon, you find in the altered state of health, as per aphorism number 6, you find cough, which is better by movement, which is walking in her case, and aggravation on a stage. Her concomitant symptoms are of anxiety, closed rooms aggravate, darkness aggravates, and in the past history there is no significant thing. Her dispositional features are very anxiety about health. She has a bad news and she's very risk averse. She's anxiety in the new place. She's very diligent. She's mild. She's yielding, but tremendous stage fright and crowds. So if you look at this history, one would tend from her dispositional want to give her either calcarea or calcarea silicata kind of remedy. But I put this remedy in the therapeutic pocketbook, and I found this something very interesting. The symptoms that I put in the therapeutic pocketbook were cough in general, better by movement, aggravation in a room, anxiety and fearful, it's a broad rubric, aggravation, emotions, fright, fear and anxiety, aggravation, darkness, and better in light. If we look at these remedies, what is very interesting, that calcarea carb is actually getting ruled out because calcarea is worse in light 4 marks and better in light 2 marks. So the remedy that we was thinking is ruled out. But now there is something very interesting. If you look at the remedy with the highest polarity difference, for those who wish to understand more about polarity difference, I have done web series on the therapeutic pocketbook and the polarity difference. They can get in touch with me for the whole web series. It is still available for all of you to review. So if you look at the remedy with the highest polarity difference and which covers the most peculiar symptom, which is better in the movement and aggravation in the room, we find the remedy strontium carb. As compared to calcarea carb, strontium carb is better by light 4 marks. Strontium carb is better by movement 2 marks and worse in a room again 2 marks. So instead of calcarea, just one step below calcarea in the periodic table is strontium. So this lady received strontium carb 1 ml. Very few doses were needed, and she has almost never got the attack of her asthma or even mild cough or respiratory tract allergy since the treatment is started. It is now almost 2 years of the follow-up. She could also go up climbing the mountains for her pilgrimage, yet she had no problems. So this is the effectiveness of homeopathy with no side effects. We have her peak flow readings done for right from the beginning to the present day, and there is a clear improvement in her peak flow readings. The peak expiratory flow rate, also called FEV1, which is forced expiratory volume in the first second of the expiration. The FEV1, or the peak expiratory flow rate, documents and is indicative of the amount of obstruction of the small airways, which happens in asthma. So I leave you with food for thought. Look at this remedy, strontium carb, which is very similar to calcarea carb, and it is only because of the therapeutic pocketbook that I could prescribe this remedy. Else, one would have definitely ended up giving a remedy like calcarea or calcarea silicata. So, good luck to all of you, and best of luck to treat asthma patients who come seeking for help in homeopathy. So, see you soon on the Childhood Mental Health Day, where we will we will get some experts, psychiatrists to work with childhood mental health, and we have very interesting discussion on that day. So keep watching this space, and we will come back to you very soon. Take care.